Meanwhile, healthcare workers across the country frequently report shortages of protective equipment and basic medical supplies. Preventable diseases remain a national crisis. Uganda ranks 3rd globally in malaria cases and 8th in deaths, with rural subregions experiencing the highest transmission rates, WHO 2022. At the same time, non-communicable diseases, NCDs, such as diabetes, hypertension, and cancer are on the rise, posing a growing threat to public health and requiring urgent investment in preventive and long-term care services. Between 33 and 35% of all deaths in Uganda are now attributed to NCDs. This reflects a broader crisis in Uganda's health system, one that is largely dysfunctional across the entire life cycle, from maternal care to adult and elderly health, undermining individual well-being and national productivity. Education. Uganda's education and health systems have fallen short in developing a skilled and productive workforce. The Human Capital Index (HCI) for Uganda stands at 0.39 on a scale from 0 to 1, meaning that under current health and education conditions, the average child will be only 39% as productive as they could be with full access to quality services. This reflects significant gaps in both educational quality and health that constrain future workforce productivity. While primary school enrollment rose from 2.6 million in 1995 to 8.7 million by 2017, the average learning-adjusted years of schooling (LAYS) is only 4.3, compared to 6.8 years of actual schooling. This highlights the poor quality of learning outcomes despite increased access. Rural regions suffer significant infrastructure deficits. In Napik district, for example, none of the 7 sub-counties nor 20 parishes have a government-aided secondary school, despite repeated official promises by the NRM government. The rest of Karamoja sub-region is in a severe state. School attendance remains uneven and inequitable. Only 40% of children aged 3 to 5 attend early childhood education, 80% of those aged 6 to 12 are in primary school, and just 25% make it to secondary school. Secondary school enrollment among the richest 20% districts in Uganda is 43.1%, 5 times higher than among the poorest 20%, which stands at just 8.2%. Enrollment is highest in Kampala, 52%, and lowest in Acholi, 7%, signaling a deliberate failure by the NRM government to uplift the most vulnerable Ugandans, citing hard-to-reach areas. The cost of educating a child in Uganda continues to strain family incomes, pushing many households into poverty. Some families are forced to sell plots of land to keep children in school, often without any guarantee of school completion or future employment. The NRM government celebrates its UPE program, yet it allocates a laughable 20,000 Ugandan shillings per primary pupil per year. In FY 2024-25, only 2.497 trillion Ugandan shillings, about 2.9% of the national budget, was allocated to education, significantly below the unrecommended threshold of 15%. In comparison, health received only 20 Ugandan cents, 0.946 trillion, about 3.9% of the national budget, and social protection a mere 355.79 billion Ugandan shillings, about 0.2% of the national budget, compared to a roughly 57% spent on official meals, allowances and entertainment. Girls face systemic barriers. Poverty, teenage pregnancy and school-related abuse force many out of school. 60% of dropouts cite costs, and 8% cite pregnancy as the main reasons. Boys, on the other hand, are often neglected partly due to a common cultural perception that a man must struggle, leading many to drop out prematurely due to lack of support. In a nutshell, poor learning outcomes limit productive employment and economic growth. Infrastructure gaps leave entire regions underserved, reinforcing inequality. Weak financing and low public investment continue to fuel high dropout rates and persistent inequity. Safe drinking water and sanitation. Safe drinking water, proper sanitation, and hygiene are vital for societal well-being in countries at any income level. Improved water sources include piped water, boreholes, protected wells and springs, and packaged or delivered water. Globally, Sub-Saharan Africa lags behind in access to safe water at 32%, compared to 98.2% in Europe. In Uganda, just 18.7% of people use drinking water from an improved source that is on premises, available when needed, and free from fecal and priority chemical contamination, according to Macrotrends data for 2022. A separate source, water.org, states that out of Uganda's 48 million people, 38 million, 80%, lack access to both safe drinking water and a safe toilet. In terms of cost, urban poor households sometimes spend more than 22% of their income buying water from vendors due to lack of reliable and affordable piped supply. In terms of cost, urban poor households sometimes spend more than 22% of their income buying water from vendors due to lack of reliable and affordable piped supply. Many rural families still spend over 58 minutes walking to collect water, reducing time for productive work and school, consistent with regional WASH surveys. Only 11% of rural households have access to piped water, compared to 46% in urban areas, and 70% in Greater Kampala. More than 50% of households use pit latrines without a slab, 5% have no sanitation facility at all. In financial year 2024-25, only SH's $516.78 billion was allocated for climate change mitigation, natural resources, environment including water resources management, a figure far below the need for the WASH facilities. Public infrastructure. Transport and energy introduction. Transport and energy sectors power the economy, connect communities, drive trade, and improve quality of life. Yet, today, millions of Ugandans remain disconnected by poor roads, unreliable transport systems, and limited access to clean and affordable energy. The vast majority of people have to rely on neglected road network, while rail, water, and air transport are underdeveloped. In the energy sector, the majority of Ugandans rely on raw biomass, with electricity access still low and renewables like solar and wind grossly underutilized. Situation analysis. Road transport. Land transport is by far the most utilized in Uganda, handling over 96% of cargo and passenger traffic, IMF, 2024. Road network spans approximately 159,364 kilometers, but only 6,338 kilometers is paved nationally, representing up to 3.9% of the total road network. The roads are classified into national roads, approximately 20,854 kilometers, district roads, approximately 38,603 kilometers, urban roads, approximately 19,959 kilometers, and community access roads equals approximately 79,948 kilometers. Based on random assessment by the NUP Policy and Research Department, of the paved roads, only 20% is in fair condition, while the rest, 80%, are in poor and deteriorating road conditions. Evidence from Kampala City Scoping Study by the African Cities Research Consortium and Kampala Capital City Authority indicated that Kampala, which contributes up to 75% of the national revenue collection and 65% of the country's GDP, has only 600 kilometers, about 29% of the city's road system being primarily paved or tarmacked out of the total length of 2,100 kilometers. Most of the paved roads in Kampala, totaling 360 kilometers, are over 35 years old and have undergone multiple patching and repairs. A well-paved road will require reconstruction after 15 to 20 years. Out of the total country's road network of 159,364 kilometers, central government only funds about 13% through UNRA, Ministry of Works, and the remaining 87% responsible for local governments, which are significantly underfunded. This is the reason why safety on Uganda's roads remains a major concern. The Uganda police recorded over 12,000 road traffic accidents annually, with an average of 10 people dying per day from crashes, according to the Office of the Auditor General's 2022 report. While there are several factors contributing to these accidents, mostly the structure and design of our roads. Railway transport. More than 60 years after getting independent, Uganda running on a railway network inherited from the colonial era. Even then, this network is largely underutilized. Of the 1,250 kilometers of meter-gauge railway, only about 321 kilometers are operational today, mainly the line from Malaba through Tororo to Kampala, with links to Port Bell and Jinja. Only recently, in May 2025, did Uganda sign an $800 million loan agreement with the Islamic Development Bank (ISDB) to fund the construction of its long-delayed standard gauge railway (SGR) to connect to Kenya's SGR and increase efficiency in transporting goods from Mombasa Port. Reuters, May 2025. Water transport. Uganda is endowed with large water bodies, including Lake Victoria, Lake Albert, and Lake Kyoga, which present big opportunities for inland water transport. In total, water bodies cover approximately 15% of Uganda's surface area. Like railway, water transport has been neglected by the NRM regime. The government operates only a few ferries while privately owned risky boats dominate Uganda's water transport for both passenger and freight services. Air transport. Uganda remains poorly connected by air, with a national aviation system that falls far short of its economic and geographic potential. While Entebbe International Airport has recently shown signs of revival, handling 2.24 million international passengers in 2024, a 16% increase from 2023, this growth has been largely attributed to loss-making Uganda Airlines' expanded routes and the entry of new regional carriers like Kush Air and Premier Airlines. Cargo activity also rose, reaching 67,731 tons in 2024, up from 59,073 tons in 2023, according to media reports. But behind these figures is a crisis. Entebbe remains Uganda's only fully functional international airport, and even it is operating below its full potential. The rest of the country is virtually cut off by air. A network of 13 up-country aerodromes, including Arua, Gulu, Kasese, Kasoro, Jinja, Sorota, Moroto, Tororo, Masindi, Lira, Mbarara, Pakuba in Murchison Falls National Park, and Kidipo, has been neglected for years. These regional airports should have served to connect Uganda's diverse regions to the capital and to each other. Instead, they suffer from chronic underfunding, poor maintenance, and extremely low air traffic. Meanwhile, the Uganda Air Cargo Corporation (UACC), established to support export logistics and regional cargo transport, has become a symbol of state failure. According to the 2024 Auditor General's report, UACC is among the worst-performing public enterprises, alongside Uganda Airlines and the Uganda Railways Corporation. Its fleet is largely grounded, revenues are far below targets and not breaking even for years, assets are grossly underutilized, and it holds massive unpaid receivables, some outstanding for over 5 years. These indicators paint a stark picture of mismanagement, financial inefficiency, and lack of accountability. The problem goes deeper. Under the NRM government, air transport has never been treated as a strategic priority for national development. The Uganda Civil Aviation Authority (UCAA), mandated to oversee and promote air transport, has been mired in incompetence and scandal. General Museveni himself recently acknowledged irregularities in UCAA's recruitment process, going so far as to order the dismissal of over 150 staff. This is symptomatic of a broader governance failure that continues to undermine the aviation sector. Energy sector. Uganda's energy sector falls far short of its potential to transform lives, drive industrialization, and power equitable economic development. Millions of Ugandans still lack access to affordable and reliable energy, despite large infrastructure investments that have been dogged by high costs due to corruption. Less than 20% of rural households are connected to the national grid, and in urban areas, frequent power outages and high tariffs make electricity unreliable and unaffordable for most households and businesses. Uganda enjoys now 4 large hydropower plants at Nalubale, Kira, Isimba and Karuma, with a combined generation capacity of 1,163.2 megawatts. Other sources such as Kigwebia, Exabo Nakanj solar power in Mubend, etc. have added another 888.8 megawatts. This brings Uganda's total installed electricity generation capacity to 2,052 megawatts. Despite this sharp increase in electricity generation, many Ugandans struggle to access it in terms of connection to grid and cost. For instance, both grid and off-grid connections account for 42% of access to electricity in Uganda. So why doesn't everyone have access to electricity yet it is generated here? A critical challenge is the distribution of the electricity grid. Given that a significant portion, over 70%, of Uganda's population resides in rural and remote areas, the existing grid infrastructure doesn't reach them, resulting in a substantial portion of the population being without access to electricity. The Uganda National Household Survey 2019-2020 stated that the Ugandan electricity grid reached 18.9% of Ugandans, mainly in urban areas. Off-grid access describes alternatives to the national grid, such as solar home systems, mini-grid systems, or smaller power-generating devices. The per capita electricity consumption in Uganda was only 75 kilowatt-hours in 2019, while in Germany it is 6,787 kilowatt-hours a. Notably, Uganda's power sector is primarily driven by renewable energy sources, accounting for an impressive 98% of electricity generation. Fossil fuels contribute only 2% to the electricity mix, reflecting a strong commitment to sustainability as well as a high potential of resources. The solar resources are enormous and delivered access to electricity for 38% of the population throughout the country in 2019. Biomass. Biomass, mainly firewood and charcoal, accounts for over 85% of Uganda's total energy consumption. This heavy reliance is fueling deforestation and exposing millions, especially women and children, to health risks from indoor air pollution. The lack of investment in clean cooking alternatives remains a public health and environmental crisis. Solar energy. Solar energy offers a clear, decentralized solution to Uganda's rural electrification challenge. Yet, despite strong potential, the sector has remained underfunded and marginalized in national planning. There is no coordinated national push to scale up off-grid solar for schools, health centers, and households. Wind energy. Wind energy remains an untapped opportunity. Viable wind speeds have been identified in regions such as Karamoja and the Lake Victoria Basin, but no meaningful investments or pilot projects have followed. Conclusion. Uganda has a young, dynamic population full of potential, but without serious investment in education, health, skills, and jobs, that demographic dividend and potential will remain wasted. Our schools are underfunded, our health system is crumbling, and millions of youths are stuck in low-paying and insecure work. This is not just a development failure, it is a national emergency. We can only build a prosperous Uganda by first investing in its people. Human capital development is the foundation for economic growth, social justice, and national transformation. Without it, the demographic dividend will become a demographic disaster. R. Promise for a new Uganda now. 4.1 Health is a right, not a privilege. We will progressively increase health spending to 15% of GDP to deliver quality, accessible care for all. We will recruit 16 times the current number of doctors and triple all other health workers to match population pressures. We will place a doctor and a fully equipped health center 3 in every parish, prioritizing underserved areas. We will procure helicopter ambulances for regional hospitals and positron emission tomography, PET scan systems to enhance emergency and diagnostic care. We will ensure every LC1 is within 5 kilometers range of a functioning health facility. We will equip and pay village health teams, VHTs, and empower them to manage preventable diseases at village level. We will launch nationwide telemedicine and mental health telecounseling platforms to reach remote areas. We will build a national mental health facility in each of northern, eastern, and western Uganda. We will reform National Drug Authority and joint medical stores to fix chronic supply issues. We will provide housing, power, and incentive packages to attract and retain health workers in rural areas. We will strengthen postgraduate medical education and regional medical school infrastructure in all regions. 4.2 Clean water for all. We will ensure universal access to safe drinking water, including free piped water, solar-powered and motorized boreholes. We will provide at least 10 improved water sources per LC1 village, prioritizing underserved rural areas. We will cut urban water costs to as low as 10 shillings per 20-liter jerrycan through public investment and targeted subsidies. We will make safe sanitation and hygiene a national standard, with regular inspections, awareness drives, and facilities. Toilet access will be free for all. We will require city, municipal, and town authorities to provide sufficient and clean public toilet facilities at no cost to users in all public places in melting urban areas. We will require city and municipal governments to enforce solid waste and sewage management laws. We will support private sector innovations in recycling and renewable energy from waste. 4.3 Every child deserves a decent education. 4.3.1 Early Childhood Development, ECD. We will review and reform all ECD policies to align with international standards. We will make ECD free and compulsory in all public primary schools and establish a public ECD center in every LC1 village. We will assess, accredit, and monitor private ECD providers to meet government standards. We will prioritize ECD access for working mothers, especially in the informal sector, through affordable childcare solutions. We will absorb at least 90% of trained ECD teachers into the government payroll and expand teacher training programs. 4.3.2 Primary and Secondary Education. We will make primary education completely free and compulsory, including meals, scholastic materials, and uniforms. We will implement a practical, skills-focused curriculum that reduces exam-driven cramming. We will build classrooms, hire more teachers, equip schools, and ensure that teachers are well paid. We will ensure a maximum 140 teacher-student ratio to guarantee quality learning for every child. We will provide free sanitary pads to all girls in schools and run nationwide retention campaigns. We will evaluate and increase resources for learners with special needs and strengthen institutions that serve them. We will embed market-oriented technical and vocational skills in secondary education to prepare learners for real jobs. 4.3.3 Tertiary and Vocational Education. We will make technical and vocational education and training (TVET) a first-choice path, not a fallback, equipping all regional BTVETs with modern tools and experts. We will introduce mandatory TVET electives in primary and secondary schools to build skills for production early. We will implement scholarship and retention programs for underserved regions and vulnerable youth. We will provide one access to digital tools, tablets, laptops in public institutions. We will revise university curricula to align with market needs and public policy development. We will upgrade health and teacher training institutions to increase the supply of skilled professionals. 4.4 Transport. 4.4.1 Build and maintain roads that last. We will increase local government funding for road construction and maintenance, raising the paved share of the national road network from 3.9% today to at least 20% by 2031. We will provide every district with a full set of road construction and maintenance machinery, graders, rollers, tractors, dump trucks. We will establish a national road safety authority to enforce safety standards and reduce road deaths by 50% within 3 years. The authority will operate as an independent, statutory body with clear legal powers to enforce national road safety standards, oversee driver licensing, regulate vehicle fitness, and monitor compliance with traffic laws. It will coordinate with the Uganda Police, the Ministry of Works and Transport, and local governments to identify and address high-risk road segments, implement public education campaigns, and conduct regular audits of road infrastructure. The authority will also collect and publish comprehensive road safety data to inform policy decisions, guide investment in safer roads, strengthen accountability, and foster a culture of safety and responsible road use nationwide. We will launch a Reconstruct Kampala Roads program to rebuild the city's 360 kilometers of aged paved roads and expand tarmacking to at least 70% of the network by 2030. 4.4.2 Modern Rail for Trade and Jobs. We will fast-track construction of the Standard Gauge Railway (SGR) with strict anti-corruption safeguards, ensuring freight trains run from Malaba to Kampala within 5 years. We will launch a major modern railway project connecting the 4 major regions of Uganda to the capital city. This railway will reduce transport costs, improve the movement of goods and people, and unlock regional economic potential. By linking all major regions, we will strengthen trade, enhance access to markets, and promote inclusive national development, ensuring that no part of Uganda remains isolated from the opportunities of a connected economy. 4.4.3 Safe, affordable, and reliable water transport. We will modernize key ports and landing sites on Lake Victoria, Lake Albert, and Lake Kyoga, including the construction of passenger terminals and cargo handling facilities. We will acquire state-of-the-art ferries to provide safe, efficient, and reliable public water transport services. We will support private water transport operators in acquiring modern boats and ferries, enhancing safety, efficiency, and service quality across Uganda's waterways. 4.4.4 Connect Regions, boost tourism through air transport. We will upgrade at least 5 regional airports, Gulu, Arua, Kasese, Sorota, and Mbarara, to handle commercial passenger flights by 2030.